So hello everyone, Dr. Nasir here, your Dr. Blueprint. Hope your NEET-PG 2025 exam went well. As we have seen, the exam was easy to moderate. And if you talk about microbiology, so most of the questions were direct, straightforward, hardly they require any explanation. So with that, let's see the microbiology questions. So with that, before we begin, you already know that this is a recall session. So if there are any corrections needed in the questions and options, always welcome. With that, first question, sir, if you talk about the sir overall, sir, how many questions for the first time I saw the questions are little less from microbiology. Sir, usually we get around 24 to 25 questions from microbiology. So this time we have got, sir, somewhere around 18 questions from microbiology. So 3 from general micro, 2 from immunology, 6 from bacterial infectious diseases, 2 from viral, 3 from fungal, and 2 from parasitic infectious diseases. In the same order we'll discuss, starting with the general microbiology questions. Sir, first question, sir, an abattoir worker, right? Abattoir means the people who work in the slaughterhouses, means something related to animal. Work presented with pustular lesion on the dorsum of the hand. The lesion is skin lesion, skin disease acquired from animals, right? The organism cultured from the lesion showed Mecfadens positivity, and it is a gram positive bacilli. Gram positive bacilli. What is the likely cause? So these are the key points in the question what you have to focus. Sir, first of all, it is a zoonotic disease acquired from animal. Which animal? They have not mentioned here. But they have mentioned the lesion. The lesion is pustular lesion showing Mecfadens positivity, means it is a skin disease manifesting with pustular lesion. Sir, Mecfadens positivity, Mecfadens reaction, it is done to identify the polypeptide capsule. And polypeptide capsule is found in Bacillus anthracis. Right. So the only bacteria which is having polypeptide capsule is Bacillus anthracis. That's why the answer goes with Bacillus anthracis. So very simple, straightforward question. So the key point is Mecfadens positivity. And Bacillus anthracis causes a disease anthrax. It is acquired from an animal, that is cattle or sheep, and it forms malignant pustule. Finally, it will become black eschar, cutaneous anthrax. So the diagnosis is cutaneous anthrax, and the answer is, so one key point is Mecfadens staining, right, directly from the revision videos. Right, capsular identification, how to identify polysaccharide capsule, how to identify polypeptide capsule, right? Sir, polysaccharide capsule and polypeptide capsule both can be identified by negative staining and latex agglutination test, but Quelling's reaction can detect only polysaccharide, and Mecfadens staining can detect only polypeptide. Very simple, straightforward question. Polypeptide capsule, Bacillus anthracis. So second question, group A streptococci are one of the most common organisms causing pharyngitis in children. What component of organisms helps it adhere to the fibronectin of the host cells? See, if you talk about flagella, flagella is a organ of locomotion, and remember, all cocci are non-motile. Remember, all cocci are non-motile. Though there are some exceptions, all means it is almost all. There is nothing ideal in this entire universe. But in general, we consider all cocci are non-motile. So Streptococcus is not having flagella. Flagella is the organ of locomotion. Capsule, Streptococcus is having capsule, and Streptococcus is the only bacteria which is having hyaluronic acid capsule. So remember, hyaluronic acid capsule is there only in Streptococcus, and the function of capsule is it is anti-phagocytic. It prevents the bacteria from getting killed by phagocytosis, not for colonization or adhesion to cause pharyngitis. Now, lipoteichoic acid and lipoprotein. So lipoteichoic acid and lipid plus protein, lipid plus teichoic acid. Remember, this lipoteichoic acid is a sticky material which helps the streptococcus to stick into the pharyngeal epithelial cells to cause colonization, causing, what is that? Pharyngitis. That's why the answer is lipoteichoic acid. It is for adhesion. So lipoprotein is just a component of cell wall, which is required for the formation of cell wall. Though it is also having sticky property, but not like lipoteichoic acid, which specifically adhere to the fibronectin of the host cells. So usually organ of adhesion is fimbria. Now streptococci don't have fimbria. Instead, streptococci is having lipoteichoic acid. With this, they will stick to the pharyngeal wall, causing Pharyngitis. So lipotecoic acid is the answer. Very simple. So if you talk about the next question, sir, which of the following is used for syndromic diagnosis of infected cases like meningitis? So now you take the CSF sample. You don't know which organism is there. You have to identify which is the organism. Syndromic approach means identifying the multiple organisms. Identifying the multiple organisms. Sir, if you have to identify multiple organisms, you have to go for multiplex PCR. Sir, uniplex PCR identify only one organism. Multiplex identify can identify more than one organism. It can be used for syndromic approach for identifying multiple organisms. So nested PCR, here we do 2 rounds of amplification. 2 rounds of amplification is done. So normally in one PCR we do 1 round of amplification. Here we do 2 rounds of amplification, which increases specificity. Which increases specificity of the organism. Otherwise, multiple organisms can't be detected. RT-PCR is nothing but uniplex RT-PCR. It can also detect one organism unless until it is not multiplex. Sir, RT means reverse transcriptase. It can detect RNA and also DNA, whereas conventional PCR can detect only DNA. So ultimately, sir, multiple organisms. Syndromic approach means multiple organisms can be, any organism causing meningitis can be detected, like multiplex PCR. So these are the 3 questions from general microbiology. Sir, very easy, simple, straightforward, not at all difficult, hardly they require any explanation. So moving to the next 2 questions from immunology. So this question, if you see, a 30-year young man presents to the clinic with recurrent history of disseminated gonococcal infection. Cultures of urethral discharge and synovial fluid from knee showed growth of Neisseria gonorrhea. Which of the following? So the question is on complement deficiency disorders. We have 6 important complement deficiency disorders. In that, one is disseminated gonococcal infection, that is due to the deficiency of C5, C6, C7, C8, and even if you include C9, it will become membrane attack complex. We call it as MAC. Sir, MAC is affected, then you get disseminated gonococcal infection. So straightforward, they're asking what is the defect? The defect is deficiency of membrane attack complex. Right. So first question on immunology is complement deficiency disorder. Second question on immunology is, right, sir, patient with recurrent respiratory tract infection, B cell, T cell not formed, combined immunodeficiency disorder. Very simple, complement deficiency disorder, combined deficiency disorder. Again, they are given the defect ADA deficiency directly from class notes, and also it is mentioned in revision videos. The answer is ADA deficiency SCID, severe combined immunodeficiency disorder. So 3 questions from general micro, 2 questions from immunology is simple, sir. Complement deficiency disorder, immunodeficiency disorder. You just have to remember the defect. There are multiple disorders. So next question from bacterial infectious diseases. Sir, examiner's favorite, Neisseria. Neisseria remains always, recently from past 3 years, in both NEET and INSET, Neisseria has been proved to be the favorite of the examiners. A patient was brought to the emergency room with acute onset of neck stiffness. When you see neck stiffness, so diagnosis is meningitis, right? And fever, who later succumbed to the illness. Given was the image of the patient died due to illness. Given was the image of the post-mortem findings of the brain, which contain petike in the brain. Sir, meningitis with petike on skin and brain is a characteristic feature of Neisseria meningitis. Simple. So remember, bacteria can cause meningitis, virus, fungi, parasites can cause meningitis, but meningitis with petechial rashes you can see in viruses, but among the bacteria causing meningitis, bacteria are the most common cause of meningitis. If you have seen our revision videos, you would have seen, sir, which bacteria causes meningitis? Pneumococcus, meningococcus, Haemophilus, influenza B causing meningitis in adults, group B, Streptococcus, E. coli and Listeria causing meningitis in children, chronic meningitis caused by Mycobacterium tuberculosis. Sir, among all the bacteria causing meningitis, the only bacteria causing meningitis associated with petechial rashes is meningococcus. This is the characteristic feature. Remember, sir, viral meningitis most commonly associated with rashes, but bacterial meningitis won't be associated with rashes. If bacterial meningitis associated with rashes, petechial rashes either on the skin or in the brain, it goes in favor of Neisseria meningitis. So meningitis. Sir, many students said, sir, Cryptococcus is the answer, sir. There is nothing in the question or in the image favoring Cryptococcus. Nothing. Sir, first of all, Cryptococcus mainly involves meninges. Brain involvement is rarely seen, less than 20% of the cases. Mainly involves meninges. Brain involvement is rarely seen. Petechiae are rarely seen. Petechiae are rarely seen. Right, sir. Mycobacterium tuberculosis, sir. It can, all of them they cause meningitis, but petechiae, sir. Petechiae are characteristically seen with Neisseria. So the key point to answer Neisseria meningitis is petechiae. Sir, if it is Cryptococcus, question should have been an immunocompromised condition like HIV patient. Cryptococcus causes meningitis only in immunocompromised patients, or most commonly in immunocompromised patient. Sir, patient like HIV or immunocompromised is not mentioned here. Nothing is favoring Cryptococcus. Petechiae are not seen in Cryptococcus. Tubercular meningitis, petechiae are not seen. Petechiae are not seen. So nothing is going in favor of any of these options except petechiae, which goes in favor of Neisseria meningitis. Very simple. So next question, sir. Patient presented with high grade fever, headache and knuckle rigidity. Again knuckle rigidity. Again, sir, meningitis. Meningitis. From past 1 day, meningococcal meningitis. So they say meningococcal meningitis conferred. They themselves have given the diagnosis. Which of the following is the drug of choice for chemoprophylaxis of the contacts of this patient? Means some person has come in contact with a patient suffering from meningococcal meningitis. Now this person, because come in contact with the patient, there is a chance that this person may get meningococcal meningitis. That's why this person has to take chemoprophylaxis. Prophylaxis from chemo, chemicals means drugs. What is the drug of choice? Rifampicin. Remember chemoprophylaxis. Remember chemoprophylaxis. Chemoprophylaxis for meningococcus. For meningococcus and diphtheria contacts. Very important for exams. Meningococcus contacts and diphtheria contacts. Diphtheria contacts. Very important for entrance exam. Multiple times repeated. Sir, for meningococcus, it is rifampicin. And remember, when you see the rifampin, don't get confused. Rifampicin, rifampin, both are same. And here, erythromycin. Here, erythromycin. For diphtheria contacts, erythromycin. If erythromycin is not there, you can use penicillin. If erythromycin is not there, you can use penicillin, but preferred is erythromycin. So, diphtheria contacts, meningococcal meningitis contacts, prophylaxis, very important, very simple, rifampicin and erythromycin or penicillin. That's why the answer is rifampicin. Sir, ethambutol, doxycycline, amoxicillin, these are hardly related to meningococcus. Right. So that's why this is the question. So 2 questions on meningitis. One is they have given the petechiae in the brain and asking what is the diagnosis, meningococcal meningitis. Second, they're telling patient is already meningococcal meningitis. What is the chemoprophylaxis? Answer is rifampicin. Answer is rifampicin. So drug of choice for meningococcal meningitis is ceftriaxone. Drug of choice for meningococcal meningitis is ceftriaxone. For chemoprophylaxis, we use rifampicin. So next question. A patient presented with brain abscess in the parieto-occipital region. Lab findings showed gram-positive bacilli, which is filamentous bacteria. Zn staining showed branching filamentous acid-fast bacteria. Paraffin bait culture positive. Right, examiner is telling बेटा अब तो आंसर कर दे, है ना. Brain abscess is given. Filamentous bacteria, right, which is acid fast. Paraffin bait culture, everything goes in favor of nocardia. Everything goes in favor of nocardia. Sir, brain abscess can also be seen in actinomycosis, which is caused by actinomyces. Brain abscess can also be seen in actinomycosis, which is caused by actinomyces. And brain abscess is also seen in nocardia. Nocardia. Right? Both are gram-positive bacilli, which are filamentous. But acid fast, nocardia is acid fast. And paraffin bait culture, remember paraffin is a growth factor. Paraffin is a growth factor for nocardia, which is used in the culture method. We use paraffin to grow nocardia. Right, sir? Acid, again directly from class notes, mentioned in revision videos also. Sir, we have 2 acid fast bacteria. One is Mycobacterium tuberculosis, which is acid fast and non-filamentous. One is nocardia, acid fast and filamentous. Direct, simple, straightforward question. Right, so 2 questions from meningitis, 1 from nocardia. 3 total 6 questions from bacteriology. Right, 3 got over. 4th one, sir. An old age home, sir. Old age, right, home resident son who is a farmer brought food for all the residents. Most of them presented with abdominal pain and bloody stool. So diagnose gastroenteritis. Old people getting gastroenteritis. On stool examination, polymorphonuclear cells and gram-negative rods. Okay, neutrophils are there, and these are gram-negative rods. So gastroenteritis caused by gram-negative bacilli. On epidemiological investigation, it was found out that all the affected residents has drank the same milk. Okay, the given the source. Sir, gastroenteritis source is milk. Sir, once you see the milk, immediately you have to think of Staphylococcus aureus. So Staphylococcus aureus is the one which usually cause gastroenteritis, and the source is milk. Whereas Vibrio parahemolyticus, the source is seafood. Campylobacter jejuni, the source is poultry, that is chicken and milk. Sir, Clostridium perfringens, sir, canned food, canned vegetables and canned meat, means packed food, preserved food, ready to eat, ready to cook food. Sir, all of them they cause gastroenteritis. I have written the source. But one important what I want to highlight is they have told gram-negative bacilli. So Staphylococcus is gram-positive bacilli. That's why I will rule out. Right, and then Clostridium perfringens is gram-positive bacilli. That's why I will rule out. So now gram-negative bacilli causing gastroenteritis, we have two. One is Campylobacter jejuni and one more is Vibrio parahemolyticus. Vibrio. Now you might be thinking, sir, how to remember so many bacteria are there, gram-positive, gram-negative? You attend my class, you would have seen my class. Right, even if you have seen my revision videos, from my revision videos also you can answer any bacteria which is GPB. Sir, blueprint, if you have seen the blueprint of bacteria, so in the blueprint of bacteria, easily you can remember which are gram-positive cocci, gram-negative cocci, gram-positive bacilli and gram-negative bacilli. Right, so that's why I always say, it is not you have to complete the content, you should be thorough with the content. It's okay if some content is left uncovered. Right, uncovered, but whatever you have covered, you should be thorough. If you are thorough, you are going to rock in the exam. Anyways, sir, with that, now if you see gram-negative bacilli, Campylobacter and the source is milk, obviously it goes in favor of Campylobacter jejuni, poultry and milk. Vibrio means, always remember, Vibrio requires salt. Usually it is found in seafood. So that's why answer is Campylobacter jejuni. So next question, sir. A 48-year-old patient presented with asymptomatic lesion on the right cheek. So lesion on the right cheek with central atrophy. Sir, lesion with central atrophy goes in favor of TB, tuberculosis, cutaneous TB. Again, sir, I was not knowing, sir. It's okay. Examiner is बहुत ज़्यादा मेहरबान है आपके ऊपर. So he also said, which had been slowly progressive over last 2 years, chest X-ray showed apical calcification. Again, it goes in favor of TB. Right, apical calcifications recovered from TB. So apical calcifications in the lung goes in favor of TB. Lesion with central atrophy goes in favor of TB. All these things is telling, please identify. The diagnosis is TB. The diagnosis is TB. And when we talk about the tuberculosis, whether it is cutaneous TB, in the previous INS set exam, they asked TB spine, what is the confirmatory diagnosis? Before that, they asked pulmonary tuberculosis. Whatever it is, sir, tuberculosis either affecting lung or skin or spine or meninges, whatever it is. Remember, when we talk about the tuberculosis, the first step is you have to do acid-fast staining. Acid-fast staining, because it is an acid-fast bacilli which is non-filamentous, and you have to confirm by CB-NAT, and CB-NAT is nothing but automated PCR. Sir, always remember first step and the second step for tuberculosis, whatever may be the site, cutaneous TB, TB spine, tubercular meningitis, pulmonary TB, TB lymph node, whatever it is. Sir, first step is microscopy, do acid-fast staining C, and second step is confirmed by PCR, and last step you can take off culture, LJ media. Sir, why last step you have to take off culture? We have to take culture because it is a slow grower. Tuberculosis is a slow grower. It takes 1.5 to 2 months to grow on LJ media. Till that time you can't wait, patient will die due to TB. So that's why first step, guidelines say, sir, guidelines recommend only 2 steps. Third step we are adding it because it is better to confirm even after that, but first you have to diagnose and you have to start the treatment. So that's why PCR. Nowhere they have asked what is the first step. Nowhere they mentioned about acid-fast staining. So how they are asking, how will you confirm the diagnosis? Obviously confirmatory test is PCR. right? Probe test we won't do for slit skin smear. Slit skin smear used for leprosy, Mycobacterium leprae causing leprosy. Monto test is for latent TB. Monto test is for latent TB, or to see the exposure to TB. Exposure to TB, right? So it helps in exposure to TB or latent TB. So slit skin smear is for leprosy. Probe test we won't do here. And then finally, sir, PCR is the confirmatory test. Very simple. Sir, a sewage worker presented with symptoms. Sir, sewage worker come in contact with the urine and feces. Sewage worker working in cleaning the sewage pipes, sewage worker. Sir, presented with symptoms of fever and jaundice. Sir, jaundice means liver is involved. Conjunctival hemorrhage. He later died due to disease. What is the most probable diagnosis? Sir, answer is Weil's disease, right? That is leptospirosis. Sir, again, sewage worker who come in contact with urine and feces, right? Not at all related to brucellosis, dengue fever, and hepatitis A, because brucellosis is acquired from cattle or sheep. Dengue hemorrhagic fever is acquired from, it is transmitted by Aedes mosquito. Hepatitis A, sir, fecal-oral route. Sir, Weil's disease transmitted by, sir, contaminated food and water contaminated with urine, rat's urine or the patient's urine, right? So sewage worker, they come in contact with the urine. Sewage workers are the risk factor to get leptospirosis. And leptospirosis causes what? Sir, leptospirosis causes hepatorenal syndrome with calf muscle tenderness and conjunctival suffusion, right? Sir, given conjunctival hemorrhage, there is liver involvement, sewage worker, clear cut Weil's disease. Nothing is favoring other diagnosis. Brucellosis, they should have given cattle, sheep. Myalgia, arthralgia, body pain. Dengue fever, they should have given Aedes mosquito, right? Other than that, retroorbital headache, they should have given. Hepatitis A, sir, apart from jaundice, they should have given for hepatitis A transmitted by fecal-oral route. Otherwise, they should have given it is a virus, right? Something diagnosed by doing IgM antibody ELISA, something they should have given favoring hepatitis A. Sir, nothing is there. Simple question, sir. Weil's disease. That's what I'm telling. Hardly the questions require any explanation. They are very easy and straightforward. So these are the 6 questions from bacteriology. Moving on to the virology. 2 questions from virology. Sir, a 30-year female with history of trigeminal neuralgia with, sir, whenever you see vesicles, diagnose herpes. Sir, I always tell students, if you see vesicles, stop there. Stop reading the question there. See, is there any herpes? Sir, HSV, EBV, HPV, herpes. Only one option herpes, you got the answer. Always remember this. Again, if you continue the questions, microscopy showed multinucleate giant cells. Sir, they are nothing but Zhang cells. Multinucleate giant cells, nothing but Zhang cells seen on Zhang smear. Again, it goes in favor of herpes. Which is the causative agent? Herpes simplex virus. Sir, Epstein-Barr virus, human papilloma virus, they won't manifest with vesicles. Epstein-Barr virus causes infectious mononucleosis. Human papilloma virus causes warts and cancer. And cytomegalovirus causes infectious mononucleosis and post-transplant infection. Epstein-Barr virus causes infectious mononucleosis and cancer. Therefore, herpes simplex virus is the one which causes vesicles. That's why this is the answer. Very simple. Sir, second question. Patient with cervical lymphadenopathy and a lesion on the base of the tongue. Sir, there is a lesion on the base of the tongue. Pain on eating. Lesion is there on the base of the tongue. Pain on eating. Sir, suspected cancer. Sir, I don't know suspected cancer word was given or not. But if you see the lesion at the base of the tongue, pain on swallowing favors cancer. Which among the following is the suspected cause? Sir, if you talk about cytomegalovirus, just now I said it causes infectious mononucleosis and post-transplant infection. Usually it is not related to any cancer. That's why we'll rule out. Herpes simplex virus, just now I told it causes usually vesicles, hardly seen with cancer. Ruled out. Sir, Epstein-Barr virus causes infectious mononucleosis and cancer. But what type of cancer you see with herpes? Sir, gastric cancer, nasopharyngeal carcinoma, Burkitt's lymphoma, Hodgkin's lymphoma. So these are the cancers what you see with Epstein-Barr virus. These are the four important cancers you see with Epstein-Barr virus. Sir, human papilloma virus. Sir, human papilloma virus causes warts. Along with the warts, it also causes two types of cancers: anogenital cancer, anogenital cancer, and sir, oropharyngeal cancers. These are the cancers caused by, right, human papillomavirus. Always remember anogenital. Anogenital, sir, anal cancer. Anogenital, it causes anal cancer. Genital, sir, genital, it causes penile cancer in males and cervical cancer in females. Sir, then it causes oral cancer, oropharyngeal cancer. So what are the cancers caused by human papillomavirus? Sir, cervical cancer to we study. Apart from that, you have to remember, in general, you have to remember, sir, human papillomavirus causes warts, anogenital cancers, and oropharyngeal cancers. Anogenital, anal cancer, males and females both. In genital means, sir, it causes penile cancer in males, cervical cancer in females, and oral cancers. So this is about human. That's why, sir, it goes in favor of human papilloma virus. Like human papillomavirus means you have to, instead of cervical cancer, you have to remember two types of cancers: anogenital and oropharyngeal cancers. A 30-year-old male presented with multiple swellings. Sir, 6 questions from 2 questions from virology done. Sir, moving on to the mycology, 3 questions from mycology. A 30-year-old male presented with multiple swellings. Sir, discharging black color granules, goes in favor of mycetoma. Which of the following? Sir, mycetoma is a disease most commonly caused by Madurella mycetomatis, a fungus which produces black color granules. Other fungi also causes mycetoma, like Pseudolisteria body produces white color granules. Even bacteria can cause mycetoma, nocardia, whitish yellow color granules. Right. Sir, even Actinomadura can also cause actinomycetoma, whitish yellow color granules. Sir, black color granules goes in favor of Madurella mycetomatis. And if you have studied from our revision videos, and if you have studied the blueprint of mycology, Madurella mycetomatis is what type of fungus? It is a septate mold. Septate mold means, what do you see? So septate mold means you see narrow hyphae. This is what we have discussed in our discussion, narrow hyphae. So now septate, narrow hyphae. So answer is septate, narrow hyphae. Simple, done. Arthrospores. Arthrospores are not seen in Madurella mycetomatis. Sir, arthrospores are seen. Where have you discussed arthrospores? Sir, first thing where we have discussed is coccidioides we have discussed. No, rectangular conidia, arthroconidia with fragmented hyphae. Dermatophytes, you see arthrospores. Ectothrix, endothrix. In ectothrix, arthrospores are found outside the hair shaft. In endothrix, arthrospores are found inside the hair shaft. And sir, Piedra disease. So these are the 3 places where you see arthrospores. Sir, pseudohyphae is seen in Candida. Pseudohyphae is seen in Candida. Septate hyphae are seen in all septate molds. All septate molds. Sir, septate hyphae with flower-like conidia is seen in Sporothrix schenki. Is seen in Sporothrix schenki. Therefore, nothing is going in favor of Madurella mycetomatis, mycetoma, except for septate hyphae, that is being a septate mold. Sir, they have not asked any specific thing. Sir, septate hyphae is seen in all septate molds, and Madurella is a septate mold. So we see septate hyphae. Septate hyphae with flower-like conidia is not seen in Madurella mycetoma. Flower-like conidia is seen in Sporothrix schenki. Arthrospore pseudohyphae, you never see with Madurella mycetomatis, and that's why the answer is septate hyphae. Sir, I think here many students told they have mentioned septate hyphae with 4 to 5 micron in size. That was mentioned. Some few students, they said, okay, even if it is mentioned, it is not going to make any difference. Simple question you can answer from the blueprint of mycology, even from the revision videos. Right. So next question, sir. A 65-year-old man came with complaints of cough and dyspnea. I told you, whenever you see dyspnea, diagnose it as pneumonia. Right. Old cavitatory pulmonary lesions are seen. Hilar lymphadenopathy. On HP and culture on SDA, yeast-like morphology with narrow base budding. What is the likely disease? So now everything goes in favor of histoplasma. I think in the question it was, sir, one is pneumonia. Histoplasma causing hilar lymphadenopathy goes in favor of histoplasma. Right, yeast cells with narrow base budding. Somebody told narrow base budding yeast cells. They mentioned which are intracellular. In this question, I won't see here, but if it was mentioned, intracellular yeast goes in favor of histoplasma. If it was mentioned, sir, no, sir, it was not mentioned, sir. If nothing is mentioned, this image was there. What is the image? Again, straightforward question from our revision videos. Sir, we see this is conidia. These are the tubercles surrounding the conidia. Right, these are the hyphae. Sir, you have hyphae, conidia surrounded by tubercles, 100% histoplasmosis. This image, sir, same image in blue color, it is there in our workbook, it is there in our revision videos. Right. Sir, question also favors histoplasmosis, otherwise image to 100%. Sir, candidiasis, you see budding yeast cells and pseudo hyphae. Blastomycosis, sir, blastomycosis, you see broad base budding. Coccidiomycosis, you see yeast cells surrounded by Mickey Mouse, giving Mickey Mouse appearance. Right, sir, narrow base budding and flower-like conidia goes in favor of histoplasmosis. Sir, next question. A 40-year-old patient presented with fever, cough and dyspnea. Dyspnea means diagnose it as pneumonia. Ball sample showed septate hyphae with dichotomous branching. Sir, rise Aspergillus, no? Sir, Aspergillus shows acute angle and dichotomous branching. Acute angle and dichotomous branching. A for A, that is what we have discussed from their revision videos, our regular class, and also from revision videos at Marrow. Sir, you can easily answer. Straightforward. Rhizopus, broad aseptate ribbon-like hyphae with obtuse and right angle branching. Sir, Candida shows budding yeast cells and pseudo hyphae. Sir, Listhemia corymbifera, unrelated only. We have not heard, so don't. Sometimes bouncer questions will come. No need to know what it is unless until it is important. Sir, goes in favor of Aspergillus. These are 3 questions from mycology. First one is, sir, Mycetoma, Madurella mycetoma is septate mold, so it is having septate hyphae. Second is histoplasma, intracellular yeast with tuberculate conidia. And third is Aspergillus. So next, last 2 questions from parasitology. A 4-year-old was brought to the OPD by the child's mother with a history of, sir, perianal itching is enough to answer. Perianal itching at night, enough to answer. Enterobius vermicularis. Right, thread-like worms are seen in the undergarments. Sir, usually pin-like worms are seen, not thread. They are not very long. Pin-like worms are seen. Right, thread-like worms are filarial worms. Filarial worm is thread-like worm. Anyways, they mentioned thread-like worms. It's okay. The stool was examined and showed the image. See the image. Sir, plano, one side, the egg. This is the egg. One side is plain, one side is bulged, convex. Plano convex egg. Right? Plano convex egg. One side egg is plain, one side is bulged. D-shape egg. Plano convex egg. Right, plano convex egg. Sir, 100%. This is Enterobius vermicularis. Simple, straightforward. Direct from again revision videos, you can see. Sir, the last question from parasitology. A patient presented with swelling on the lower limb. On examination, inguinal lymph nodes were palpable, and on FNAC of lymph node, the following. Sir, FNAC of lymph node, following thing was observed. What is this? Sir, this is a larvae with nuclei inside, this dark color nuclei with a sheath outside. Obviously, this is microfilaria larvae of filarial worm. Again, if you see, this is the head, this is the tail, and if you see in the tail, there are no nuclei in the tail. Sir, when there are no nuclei in the tail and sheath is present, sir, sheath is there and no nuclei in the tail, it goes in favor of Wuchereria bancrofti. So though they are not asking to identify, I'm telling you, if you are my student, you can easily identify, even with our revision videos at Mehar. Sir, that's why I say, sir, our revision videos are not just revision videos. It is, you can say, almost of microbiology. concised content, like how you concise 100 GB into 20 GB, size will decrease but content will remain same. Similarly, what we have done is in our revision videos we have compressed the content in such a way that content should not decrease to the core, content should remain, right, as much as possible. Sir, hardly by cutting the content we have concised the revision videos, right? Sir, because we have simplified, it looks very less content because we have simplified, but otherwise the content is not less. If you have seen the previous INS set and this NEET, almost of the questions you can answer from revision videos itself. Just imagine, what about if you attend the complete PG videos? If you attend complete PG videos, it will become awesome. 100% you can answer from the notes. And now almost 85 to 90% you can answer just from the revision videos. Sir, I said approximately 85% of the questions you can answer from revision videos. Approximately. Maybe 70% sometimes in some exams. But very beautifully concised and summarized. Right? Those who have thorough with the revision videos, they would have seen the result. Anyway, sir, with that they're asking, if you are my student, you can answer, this is microfilarial larvae of Wuchereria bancrofti. Whatever is it, what is the likely mechanism of presentation? So now you know, sir, Wuchereria bancrofti causes what? Lymphatic filariasis. And you know, lymphatic filariasis manifest with lymphedema. Sir, initially it will be pitting edema. Later it will become non-pitting edema due to fibrosis of skin, making the skin thick and hard. It becomes non-pitting. So they're asking the cause of edema. So cause of edema: lymphatic obstruction, increased hydrostatic pressure, hypoproteinemia, venous congestion. All these 4 causes will lead to edema. Sir, venous congestion causes edema, hypoproteinemia causes edema, increase in hydrostatic pressure causes edema, lymphatic obstruction causes edema. All these 4 causes will lead to edema, but they're asking, in this case, what is the cause? Sir, in filarial worm cause lymphedema due to lymphatic obstruction. Very simple, multiple times discussed. Very simple, straightforward question. So these are the 2 questions from parasitology what they have asked. One is Introbas vermicularis, they are given the egg, they are given the filarial worm, asking what is the cause? Lymphatic obstruction. Sir, microbiology questions were dead easy. They are straightforward. Hardly any explanation required, and hope all of you have answered. Those who have attended our complete classes, they have rocked it. And those who have attended, even those who have completed revision videos, I'm telling you, most of the questions you would have answered from revision videos if you would have been thorough with the revision videos. So with that, hope you enjoyed the recall session. And once again, please comment in the comment box, how was the session? Did you really enjoy? And how was the explanations given? With that, all the best for your results. Thank you.